Welcome to DentiMax. In the digital age, everybody is starting to go paperless. DentiMax has some great tools to help your office do so. One of the greatest tools we have in DentiMax is the Document Center. If we pull up our patient list, and by choosing Sandy's name first, then double-clicking on the double sheet of paper icon in the top right corner, it'll take you right to Sandy Thompson's Document Center. We'll start from the bottom up. If I click on ID card, you can see that there's one ID card that's been loaded. Of course, this happens to actually be my business card, but just to give you an example, if we wanted to add another ID card, we could simply click Add ID card, and the scanner is ready to go. The other option, of course, is to purchase the ID card scanner, and that will capture your ID card images, be it a driver's license, an insurance card, or any kind of business card in high resolution. It'll also be able to capture those cards in color. The next section up is the image file. The image file center is used to import images or reports that were sent to you via email that you've stored on your computer. I went ahead and just grabbed a photo from my picture center so you can see that you'll be able to scan x-rays in or import x-rays that were emailed from another office right into the document center if that's a place you'd like to store them. Alternately, some other images that you may add to the image file are x-rays that your office has taken in the past that are still on traditional film that you'd like to save in history. The next section up is a scanned document, and this is one place where you can scan in documents that the patient has signed and brought into you, reports from another office that weren't emailed, or their medical history that they filled out in your office. To add a scanned document, we'll simply click Add Scanned Document. Then we'll choose the setting if we want color, grayscale, black and white. We'll go ahead and leave it at color and click Scan. The nice thing about the scanned documents is all you have to do is place the paper on the actual scanner and then choose to scan it from your computer. You don't have to stand at the scanner any longer in order to make sure this document goes in. So we can see Sandy Thompson has signed and dated this document. She's given us her consent. We have the option to add a description down here at the bottom or resize the image before we save it. You can rotate images from here, crop them, or edit them. We'll go ahead and click Save Changes in the bottom right-hand corner. And now Sandy Thompson has a scanned document added into her Document Center. The Document Center is designed to help load in those paper records from a patient's chart that you don't want to keep the actual file for or the paper for any longer. You can go back through a patient's previous medical history just by clicking through the different scanned documents that you have loaded. If you purchase the signature pad or already have one that might be compatible, you have the option to add a signed document to the Document Center as well. We have a selection of different patient letters and release forms in here, as well as consent forms that you can choose. For example, if we click on treatment consent, there's a few options here already listed. We could go ahead and choose the root canal consent and select Use Selected Item. And then if you did have a signature pad, you would click Sign at this point. The patient would scribble their signature on the signature pad. You'd click Done and Save. That would save their signature as a legal record right here on the document. You'd also have the option to print this out and hand the patient a copy. You have a space as well for a doctor's signature or an office representative if that's who you'd like to sign here. The next section up is a printed document, and this just tracks what documents you've printed and handed to the patients. We also have these patient letters. You can see there's 2 so far that the patient has had issued to them, and perhaps they've signed. You have the option right up here at the top if you have a signature pad once again for them to sign this document. You can add a patient letter, and again we have the different document options that come preloaded into the computer system. If your office has a document loaded on Microsoft Word or another program, you can create a new document and add it into the Document Center and attach a signature. It's as easy as selecting a new document, typing in the name. We'll go ahead and call this an excuse letter. Click OK. I'm going to start formatting my letter and how I want it to be displayed. So my first line is going to be my practice information. There are merge fields over here on the right-hand side of the screen for you to choose from. We'll simply double-click on the field we want, line up the next line, and continue clicking the merge fields. Once you have the basic template set up at the top, you can start either typing your document or you can copy and paste your document from somewhere else in your computer. We'll go ahead and just continue building onto this existing letter from within the program. We are now ready to add a signature section to this document in order to make it a functional document to use with the signature pad. We'll click Insert Signature, state who's signing this document, click OK. We'll tab over a few spaces and input a date that he'll sign this document. Now we can simply save our changes, and we have an excuse letter to use for any patient in our database based on the letter we just set up. If you find later there's something you'd like to tweak on this letter, you simply choose it and click Edit to go back to the screen we were previously in. Now if I use this selected letter, it'll pull in our practice name, our address, city, state, our practice phone number, today's date, the patient's name based on who we chose to use this letter for, and when we get to the bottom, we're ready to have the doctor sign off on this using the signature pad. You can click Done and Save, then print it out for the patient to take with them. Another neat feature of the Document Center is if a patient has a treatment plan in the chart, we can pull up their treatment estimate down here in the bottom left corner, go over the figures with them, and then have them sign this treatment estimate with the signature pad we have in the office. And that document would be saved right to Sandy's Document Center with her signature on it, which you could also print out and give her a copy to take home. Another paperless feature we can take a look at is the patient journal. Anytime you've selected a patient, be it from the patient list, the scheduler, the chart, anywhere that applies that you can choose one person, if you click the F11 key on your keypad, it brings up that patient's patient journal. The patient journal is designed for your office staff to leave notes about a patient and their contacts with this person. I personally like to have my most recent notes on the top of the patient journal. So I leave a couple spaces, then I would right click here, insert date and time, and put a little heading as to what this note might be about. Previously, I had a recall note that Sandy had wanted 3 appointments, one for herself and her 2 kids, all on the same day, and I would call her when something was available. These notes can be in regards to conversations you've had with the patient or just something you wanted to remember about them. I always like to end these notes off with my initials. If you're tired of trying to remember all of the details about a conversation you had with a patient, or maybe you're not available to communicate to another staff member everything that happened for a person that they happen to catch the phone for, you can leave your notes here in the patient journal section so that anyone can access them and update themselves about the recent activity that you and Sandy have had together. Once you create a note, you simply click Save Changes. Another paperless feature that's available for use in DentiMax is the task list. That can also be accessed from your keyboard by clicking on F12. The other option to pull up the task list would be to go to Lists and the task list window. The task list is a reminder list to follow up with patients on a certain date or for you to perform certain tasks and take care of items within a time frame. If you notice, I have a little note down here at the bottom to call Sandy Thompson regarding herself and her 2 kids. We can either double click on this item or right click and view the task, and you could read the detailed note. We can assign priority levels to these task entries so you know what the most important thing is to take care of first. You can assign this task to a specific person if you'd like, and also set a date that that item is due by, and set the date that you want to be warned about this upcoming task entry. In order to create a new task list entry, you'll right-click here in the task list window and select a new task and go to town with your notes. These can be patient-specific or just general duties that need to be performed in the office. You'll notice that this top item turns yellow, and that's because the warning for this task list item was set for today or prior to today and it hasn't been completed yet. Once this item is completed, you can right-click on it and mark it complete, and it comes off of your task list. This is a great way to get rid of the post-it note clutter on your desk and also keep yourself organized in taking care of your patients better. The last paperless feature I'd like to highlight is the clinical notes section. If I go to a chart, perhaps again for Sandy Thompson, you can see that today we have posted a comprehensive oral evaluation. I'm going to go ahead and pull our clinical notes tab over here to the right hand side of the screen so you can see that in conjunction with the charting tab. If we change our entry mode to completed in order to post a panoramic x-ray taken today, watch over here in the clinical notes section when I post that item. I'm going to go to my preventative and diagnostic menu, click on a panoramic film, and click anywhere in the blue space in the odontogram. Now, if you've noticed, that item shows up as a completed item here in the chart section. It's also been sent to the patient's ledger, and we now have a note based on that procedure code getting posted that will show up here in the clinical notes section. Pano completed in order to evaluate wisdom teeth and ortho necessity. Findings are, and the doctor or the assistant can just update what their findings are. This is what we call an automatic clinical note. This note is attached to the procedure code, and you can choose to have that pop up either when the item is treatment planned or when it's completed. In order to attach a clinical note to a procedure code, you'll want to go to your list, down to service code list, go to the item, we'll edit that item, click on your clinical notes tab, and up here you have the option for a planned note, and you can choose to use a specific template that may be in your computer or maybe one that you've already created. Or you can attach that note when this item is posted as a completed item. Once again, you can choose a template to use, or you can type in a free-form entry that will automatically post to your clinical notes every time that item gets posted as completed. Another option to simplify your clinical notes and not have to write them in a chart is to simply add templates into the computer and select a template to use when appropriate, rather than based off of when a procedure code gets posted. In order to do this, you're going to click Add Note. There's a few templates in the computer already. Let's say Sandy had some fillings done today that were decay related. I'm going to go ahead and select this note to use for Sandy and walk you through how this actually shows up in order for the doctor or the assistant to make a note. So the first line, of course, is medical history reviewed, and you can see that that question is listed over here on the right-hand side of the screen. You have this big white space in which to type in. We call this free-form entry, and I could simply type no changes to medications or medical history. When I'm done answering this question, I would click Next. The tooth number that we worked on today perhaps was tooth number 5. You can select multiple teeth from here as well. Then I would click Next. The topical anesthetic used perhaps was lidocaine, and we would click Next. How many carpioles did you use? We'll say 2, and then you have the anesthetic dosage here. Decay was removed. Decay was decay type, moderate or severe. Click Next. What type of bond brand did you use? The composite shade. Click Next. And now you've built a clinical note for Sandy Thompson simply by answering some pre-formed questions that you set up in the computer. At this point, we can click Save Note in the bottom right corner of the screen, and this is now saved to the clinical notes. There are some items that I left open-ended on this clinical note, such as next visit, so you always have the opportunity to go back and add a note right to this field. The clinical notes are going to be formatted to your office's specifications and desires. To create a clinical note template, you can simply click Add Note, choose which category you're going to put that note under, perhaps restorative, and then you're going to create a new note. The description we could call implant crown, for example. You can build your note in a free-form entry style and simply type questions in that you'd like to use for this clinical note. Or you can choose to insert questions to set this note up. There are some existing questions in your computer system that you can pull from, and some of these you may also want to edit the answers available based on what your office uses, such as the bond brand. If we choose that as a question and hit Edit, perhaps you don't use any of these options as bond brand. You could simply add an answer and type in a new option and save your changes. We'll go ahead and select tooth number in this scenario and use the selected question. And then you could continue typing in free-form entry until you're ready to insert another question. For example, the date field. If I choose from my existing questions and scroll down, you see we have an option for date of last exam. That may not be what I was looking for. So I can create a new question by clicking New and just simply type date into this field. And this bottom section is going to be what kind of answer I want to supply the computer with. I'm just going to choose date. Save changes. Now we'll select that question to input onto our note template builder for the implant crown. Once again, you can format these notes to what appeals to the doctor and your office, and make sure that every clinical note that's done for this procedure code has the same exact format and nothing gets skipped in answering these questions. We'll go ahead and save our changes and use this note just so you can see how this turns out. Select note, medical history review. Patient presents with tooth number 3, we'll say, was worked on today to restore previously placed implant. Surgery done by, on date. We're going to go ahead and click on next to go down to our next question field. We'll tab through until we find an appropriate date. We'll just say December 4th of 2012 and click next. Save our note. And once again, we still have the opportunity to make any edits to this clinical note for Sandy Thompson's chart. We'll go ahead and also make a little note up here that tooth number 3 is the focus of this particular clinical note. We'll close out, and later on when you come back to this to search for any notes in regards to tooth number 3, under View Only, you can type in tooth number 3 and it would only show you those clinical notes. Going paperless has been made easy and efficient with DentiMax. If you have any questions on how to make this work for your office, please feel free to give us a call at 1-800-704-8494. Thank you.